disorders involving anxiety are among the most common mental disorders. Anxiety is an unpleasant state of tension, apprehension, or uneasiness, a fear that arises from either a known or an unknown source. The physical symptoms of severe anxiety are similar to those of fear, such as tachycardia, sweating, trembling, and palpitations, and involve sympathetic activation. Episodes of mild anxiety are common life experiences and do not warrant treatment. However, severe, chronic, debilitating anxiety may be treated with anti-anxiety drugs, sometimes called anxiolytics, or some form of psychotherapy. Because many anti-anxiety drugs also cause some sedation, they may be used clinically as both anxiolytic and hypnotic, sleep-inducing agents. The difference between most hypnotics and anxiolytics is the dosage, not the drug. Therefore, the drugs are dealt with according to their chemical classification and not their therapeutic classification, except when there is no overlap. The plan for this video is to discuss anti-anxiety drugs. First, we have benzodiazepines, or BDZ for short. Then, barbiturates, beta blockers. Beta blockers can be useful in anxiety where autonomic symptoms predominate, like tremor, tachycardia, and sway. Antidepressants. Many antidepressants are also anxiolytic, and because they do not cause sedation and dependence, they have become the first-line drugs in the treatment of chronic anxiety states. Z drugs. We talk about Z drugs in the last section, so skip to that part if you want to. Behavioral cognitive therapy is as effective as drugs in most types of anxiety, but is not always available. It is important to remember that no currently available hypnotics induce what could be termed natural sleep. So now let us move on to the next sections and learn more about these anxiolytics and hypnotics. Stay tuned.
sqadia.com is advancing towards special video series, where we are specifically covering major aspects of pharmacology. Watch out for more subject-related series very soon on sqadia.com.